and sadly, we did add one new death. 25 cases each in both Chittenden and Washington counties. 28 people are hospitalized, 8 in the ICU. In New Hampshire, 218 new cases, 1 additional death. In our region, we're showing 16 infections in Grafton County, 8 in Coos, 2 in Sullivan. And in the North Country, Franklin County tonight reporting, sadly, 1 new death there with 23 cases. Clinton County, 13 infections, and nothing right now out of Essex. As some call for state government to take a tougher stance on COVID-19 prevention, Governor Phil Scott believes the impact of Vermont's vaccination rate is getting lost in the shuffle. Local 22's Devin Bates joins us live tonight in the newsroom with more from the governor's weekly briefing. What did he say, Devin?
Yeah, Lauren, Governor Scott said despite what you see on Twitter, Vermont is in a much better place than other states, and he continues to believe the case data doesn't justify another state of emergency. That being said, active outbreaks in long-term care facilities and prisons have a lot of folks feeling nervous again. More than 90 employees with the Vermont Health Department signed off on a letter urging state officials to recommend indoor masking regardless of vaccination status. State Health Commissioner Dr. Mark Levine said public health isn't the only factor in making recommendations.
We don't operate in a vacuum. We are not the ones who are in total control of everything that happens during the pandemic. It's a very collaborative and deliberative process.
Dr. Levine said demands outlined in the letter are fundamental public health recommendations he aligns with, and that his focus is on making sure Vermont is doing everything possible to control the level of virus being transmitted in communities. Still, both Dr. Levine and Governor Phil Scott said the decision on whether you should wear a mask as someone who's vaccinated depends on your own risk factors, who you're with, and how crowded the room is.
We should promote the use of masks during times when it's necessary, if you're assessing your situation, taking some personal responsibility, going to a concert where there's hundreds of people. Inside, you might want to wear a mask.
Every person and every situation is unique.
Dr. Levine was asked what's stopping him from publicly and strongly recommending universal masking indoors.
I thought I just did recommend masking indoors. I did not mandate it. We're not under a state of emergency.
The CDC's recommendations call for indoor masking in an area with high or substantial transmission, which right now includes all Vermont counties. Governor Scott said the CDC's one-size-fits-all policy doesn't paint an accurate picture.
These counties are in the same CDC category as counties in Florida with a per capita case rate that is 10 times higher than the highest case rate in Vermont.
And speaking of masks, Governor Scott addressed the ongoing tension over mask mandates in schools and urged people to direct concerns to state government and not school boards or superintendents. Live in the newsroom, Devin Bates, Local 22 News.
A message that seems to be coming up a lot.